Welcome to Spectacle on Television Nigeria. I am your host, Daniel Atai.
It seems that the end to COVID-19 pandemic is on sight, as Oxford University in the United Kingdom successfully tested the first coronavirus vaccine on 2 humans. While in Africa, particularly in Ghana, has boasted that the country is food sufficient and could cater for her citizens even if the lockdown continues for the next 3 years. Welcome to Spectacle on Television Nigeria. I am Daniel Atai. Stay with us. After this timeout, we'll continue the analysis.
Welcome to Spectacle on Television Nigeria. I am your host, Daniel Atai.
Welcome back. After this introduction that I would be given to you any moment from now, we shall be playing you the video which the British Broadcasting Corporation, BBC, revealed about the new vaccine, revealed or discovered in Oxford University. Now, the first human trial in Europe of a coronavirus vaccine has begun in Oxford. 2 volunteers were injected, the first of more than 800 people recruited for the study. Half, of course, will receive the COVID-19 vaccine and half a control vaccine which protects against meningitis, but not coronavirus. The design of the trial means volunteers will not know which vaccine they are getting, though the doctors will. Elisa Granato, one of the 2 who received the jab, told the BBC, "I am a scientist, so I want to try to support the scientific process wherever I can." The vaccine was developed under 3 months by a team at Oxford University. Sarah Gilbert, professor of vaccinology at the Jenner Institute, led the preclinical research, and he said, "Personally, I have a high degree of confidence in this vaccine." She said, "Of course, we have to test it and get data from humans. We have to demonstrate its actual works and stop people getting infected with coronavirus before using the vaccine in the wider population." Professor Gilbert previously said she was 80% confident the vaccine would work, but now prefers not to put a figure on it, saying simply she is very optimistic about its chances. So how does the vaccine work? That is the question you may want to ask. The vaccine is made from a weakened version of a common cold virus known as an adenovirus from chimpanzees that has been modified so it cannot grow in humans. The Oxford team has already developed a vaccine against MERS, another type of coronavirus, using the same approach, and that had promising results in clinical trials. How will they know if it works? Remember, we are giving you a solution to COVID-19 as regard the vaccine that Oxford University in faraway United Kingdom brought out, so that the pandemic could be quered any moment from now. And the only way the team will know if the COVID-19 vaccine works is by comparing the number of people who get infected with coronavirus in the months ahead from the 2 arms of the trial. That could be a problem if cases if cases fall rapidly in the United Kingdom because there may not be enough data. Professor Andrew Pollard, director of the Oxford Vaccine Group, who is leading the trial, said, "We are chasing the end of this current epidemic. And if we don't catch that, we won't be able to tell whether the vaccine works in the next few months. But we do expect that there will be more cases in the future because this virus hasn't gone away." The vaccine researchers are prioritizing the recruitment of local healthcare workers into the trial as they are more likely than others to be exposed to the virus. A larger trial of about 5,000 volunteers will start in the coming months and will have no age limit. Older people tend to have weaker immune responses to vaccines. Researchers are evaluating whether they might need 2 doses of the jab. The Oxford team is also considering a vaccine trial in Africa, possibly in Kenya, where the rates of the transmission are growing from a lower base. If the numbers could be a problem, why not deliberately infect volunteers with coronavirus and then use the vaccine to see if it would work? That would be a quick and certain way to find out if the vaccine was effective. But if it would be ethically questionable because there are no proven treatment for COVID-19. But that might be possible in the future, Professor Pollard said. If we reach the point where we had some treatment for the disease and we could quarantine the safety and guarantee the safety of the volunteers, that would be a very good way of testing a vaccine. If it is safe, the trial volunteers will be carefully monitored in the coming months. They have been told that some may get a sore arm, headaches, or fevers in the first couple of days after vaccination. They are also told there is a theoretical risk that the virus could induce a serious reaction to coronavirus, which arose in some early SARS animals vaccine study. But the Oxford team says its data suggests the risk of the vaccine producing an enhanced disease is minimal. Scientists therefore hope to have 1 million doses ready by September this year, talking about 2020, and to dramatically scale up manufacturing after that. Should the vaccine prove effective, so who would get it first? Who would get the vaccine first? Is it Europe, is it America, or is it in Nigeria? Professor Gilbert says that has not been decided yet. It is not really our role to dictate what will happen. We just have to try to get a vaccine that works and have enough of it, and then it will be for others to decide. Professor Pollard added, "We have got to ensure we have enough doses to provide for those in greatest need, not just in the UK, but also in developing countries like Africa." Another team at Imperial College London hopes to begin human trials of its coronavirus vaccine in June. The Oxford and Imperial teams have received more than £40 million of government funding. Health Secretary Matt Hancock has praised both teams and said the UK will throw everything we have got at developing a vaccine. The UK Chief Medical Advisor, Professor Chris Whitty, has said neither a vaccine nor a drug to treat COVID-19 is likely to be available within the next 1 year. We'll stop at this moment before I give you the African COVID-19 update with reference to Ghana lockdown and of course they stepped down their lockdown process, boasting that they have food security, sufficient food to cater for the nation. But I want you to take a look at how this vaccine that has been developed in Oxford University in the UK works and how it was tested on the 2 humans. Please take a look.
The first human trials in Europe of a coronavirus vaccine has begun in Oxford in what is a highly significant moment. This afternoon, 2 volunteers, both scientists, were injected. They're the first of more than 800 adults aged between 18 and 55 who've been recruited for the study. Half the group will receive the COVID-19 vaccine and half will get a control vaccine which protects against meningitis. The results won't be known for months. Already more than 186,000 people have died because of coronavirus worldwide. In the last 24 hours, 616 more deaths were recorded in hospitals across the UK. It brings the official UK death toll to 18,738, but that does not include deaths in care homes or in the community in England and Northern Ireland. Here's our medical correspondent, Fergus Walsh.
This could change everything. A vaccine against coronavirus. A way out for all of us.
Okay, so needle scratch.
The first volunteer to receive it was Elisa Granato, a microbiologist. She's 32 today.
I'm a scientist, so of course I want to try and support science, the scientific process, whenever I can. And since I don't study viruses, I felt a bit useless these days, so I felt like this is a very easy way for me to support the cause. Yeah, that's why I'm here, and I'm excited.
Half those on the trial will get the coronavirus vaccine, half a different jab. The volunteers don't know which one they've received.
I'm just basically going to sit here and incubate this thing and hopefully provide some good follow-up data, and then we'll see, and hopefully it works.
What would normally take years has been done in 3 months by scientists at Oxford University. Around 80 groups worldwide are developing coronavirus vaccines. A few others in the US and China have also started human trials. There's no guarantee any of them will succeed.
Personally, I'm very optimistic it's going to work. Formally, we are testing it in an efficacy study. There's absolutely no suggestion we're going to start using this vaccine in a wider population before we've demonstrated that it actually works and stops getting people infected with coronavirus.
So how does the vaccine work? Scientists have taken the genes for the spike protein on the surface of coronavirus and put them into a harmless virus. This forms the vaccine. After it's injected, the vaccine enters cells which start to produce the coronavirus spike protein. This prompts the immune system to produce antibodies and activate killer T cells, which should recognize the coronavirus in future and destroy it, preventing infection. The scientists will only know how effective the vaccine is if lots of volunteers are exposed to coronavirus.
Well, at this moment, we're chasing the end of this current epidemic wave. And of course, if we don't catch that, we won't be able to tell whether the vaccine works in the next few months. But we do expect that there will be more cases in the future because this virus hasn't gone away.
Why not simply infect people with coronavirus after they've had the vaccine? Then you'd know.
At this moment, it would be very difficult to do that with a disease which potentially has quite a high fatality. So I think if we reached a point where we had some treatments for the disease and we could guarantee the safety of volunteers, that would be a very good way of testing a vaccine.
The vaccine is stored in this freezer at -80 degrees. Rarely has a medical trial had so much riding on it for so many people. It is hard to overstate just how important this vaccine could be if, and it's a big if, it proves to be safe and effective. It would represent science giving us the solution to the coronavirus pandemic.
Well, I think everybody agrees it's the only way we're going to get out of the lockdown, the social distancing, and really be able to still have people protected as they go about their daily lives.
Edward, a cancer researcher, was next up. There is a theoretical risk the vaccine could make a coronavirus infection worse, but the team here think that highly unlikely, and the volunteers will be carefully monitored.
It seems like the right thing to do to ensure that we can combat this disease and get over it a lot faster.
Do you have any concerns at all about safety?
I think you can never fully exclude any sort of potential risk. But I think you have to, I guess, walk in faith in these things. You have to trust in that the work has been done as best they can, and know that the cause is important.
The Oxford team are hoping to have 1 million doses of vaccine ready by September, with a huge scale-up in manufacturing after that. It's not clear, though, who would be prioritised to get the vaccine first. And for now, we have to wait and see if it works.
And Fergus is with me now. Extraordinary how quickly they have turned this all around, but your assessment of how successful it could be?
Well, we don't get early, quick results in the UK. They're considering a trial in Kenya where the epidemic of coronavirus may well be on the rise. Now, this virus is known, this vaccine is known to produce a strong antibody response, but that doesn't necessarily equate to protection. And we're going to need many vaccines. There are dozens in development. So then we'll need billions of doses and expect a huge debate over which countries and which groups of people get the vaccine first.
Fergus Walsh, thank you. From tomorrow, up to 10 million key workers and their families will be eligible for a coronavirus test if they develop symptoms. The Health Secretary, Matt Hancock, announced that they would be able to book a test online. More testing centres are being opened, and the Army will be helping with mobile testing facilities across the country. Here's our health editor, Hugh Pym.
Home testing for coronavirus. Kits are sent out, people take their own swabs and send them back to be tested. It's part of a new plan for England, along with the expansion of drive-through centres available for essential workers, and then mobile testing facilities going to workplaces.
We are also currently working with the Army on a new pop-up mobile testing option, which was developed for us by the Army and is really working very well. So we're going to have 48 of these facilities which can travel around the country to where they're needed most, for example, in care homes.
Key workers and their families with symptoms will also be able to book tests online, but a government target for testing still looks challenging. The number of tests on hospital patients and key workers has not moved up much in the last couple of weeks. It's now about 23,000 a day, but ministers have set a target of 100,000 by the end of this month, just a week away. 3 so-called mega labs, staffed partly by volunteers, have been set up to handle the big expansion in virus testing, including this one in Glasgow, which opened this week. It hopes soon to be doing thousands of tests each day.
At the moment, there are a large number of manual processes that we're doing. We're going to bring in automation and further scale up our capacity to meet what will be inevitably significant demand.
But a survey of one group of doctors found that nearly 40% of respondents said they were struggling to get access to testing.
We want to be able to go to work, and if we have symptoms and we cannot access a test, then we're required to stay at home. We're also, we're nervous of infecting others, particularly family and loved ones.
An expanded list of workers and their families, including those in supermarkets and transport, will be able to book from tomorrow, potentially up to 10 million people. The challenge will be to ensure that the technology delivers, that those eligible can book a test easily, get it done, then get the lab result back reasonably quickly. And that leaves the question, will the government hit its target of 100,000 tests daily in a week's time? Hugh Pym, BBC News.
Welcome back. That excerpt was given to us by the British Broadcasting Corporation, and I hope you enjoyed it and you've seen that already vaccine trials has begun in UK, and we just hope that Nigerian Medical Association and the National Center for Disease Control, as well as the Dental and Medical Association of Nigeria, will begin their own clinical trial for vaccine or pursuit for possible COVID-19 vaccination. However, we will try to get in touch with the NMA chairman and the medical director of Prime Care Hospital, Dr. Eheme Ogbonnaya, to give us some take about this vaccine that has just been reviewed and what the Nigerian health sector is doing concerning their own alternative vaccination or clinical trials. However, we'll take a look briefly while we wait for their calls, or while we put a call through. We'll take this news from our African brother state or sister state, which is Ghana, where some time now, and then boasting that even if the lockdown continues for the next 3 years, they will be capable of feeding their nation, contrary to what is going on in our own country, Nigeria. And we hope that Alhaji Mohammed Sani Nano, the Minister of Agriculture, will borrow a leaf from Ghana and give us quickly the blueprint for his agricultural policies and food sufficiency that would make do in this lockdown, perhaps if the lockdown continues. An African COVID-19 update has enough food. The Ghana Minister of Agriculture, Nwosu Afriye Akoto, has assured that the country has enough food provision in store and there is no danger of food shortages even in the next 3 years. Afriye Akoto did not state how long Ghana's, after 3 years, current food reserve could last, but he said production was in excess on consumption and excess stock was even being exported to neighboring countries. We have plenty of food, he boasted. The impact of planting programs has been so successful that we now have a problem of how to manage the surplus we are producing. Farmers are providing surpluses, which are increasing every year. That has been the case during the last 3 years. You could imagine that they have taken last 3 years to produce food sufficient enough to cater for them even in the advent or in the presence or in the face of any pandemic. Let's put a call through to Dr. Ogbonnaya Iheme if he's ready to give us a take as regard what we discussed earlier about the vaccine. We'll still come back to the Ghana's versus Nigerians food production. Dr. Ogbonnaya Iheme, you are live on television Nigerian, sir. Good afternoon.
Good afternoon, too.
Now, the Oxford University have just discovered and tried a vaccine for COVID-19 on 2 humans, and I think that was a successful one. Now, what could you tell us about the vaccination that is coming from Oxford University in the United Kingdom? Do you have anything to tell us about it?
Yeah, I think it's a welcome development. It says that these are part of the strategy to get to eradicate coronavirus from the face of Earth. All right?
Yeah.
Vaccine from time immemorial has always been one of the approaches medicine has adopted to, to fight, especially diseases where kudos to the volunteers. All right? I understand about 50 people are volunteers and mostly health professionals. So I think it will definitely be a long way towards helping us to overcome this war of coronavirus. I mean, they are looking at developing the vaccine. At the moment, the trials are going on, conducted by the professional vaccinators at the Oxford. So I'm sure by the time the results come across, they are so sure of the outcome of that result.
Now, in Nigeria, we have Research Institute, and we also have the Nigerian Medical and Dental Association, as well as the Nigerian Medical Association. What are you people doing towards, vaccines? Is there any effort on our part to develop vaccines?
Yeah, the Federal Minister of Health has actually promised whoever develops the vaccine or any form of cure, any form of substance towards the fight against coronavirus. I think they promised the person 36 million as some form of reward to a lot of organizations have been positioned right from time immemorial towards this global search. I'm aware that NIMR, that's Nigerian Institute of Medical Research, is very hot on the heels of trying to discover a vaccine. Same also goes for UCH Ibadan. So it's not like in our own front, the Nigerian front, it's not as if we are just sitting down doing nothing, waiting on a vaccine. So we are also hardworking as well. The method given, and definitely the medical professionals are working hard, and I'm sure in less than no time, people will also come up with very effective and efficient vaccines or even treatments, as the case may be.
Did I hear you said the NCDC or the Ministry of Health promised anybody or any institution that will develop vaccines for COVID-19 36 million?
Yes, 36 million naira as a form of support.
Okay, are you aware that the UK government invested 40 billion pounds into this?
Yes, I'm aware as well.
Okay,